Ecstasy, also known as MDMA, is a stimulant that is classified as a Schedule I drug, which means it has a high potential for abuse and no medical purpose. Though it's a stimulant, it also tends to act like a hallucinogenic as well. Ecstasy is often taken as a pill, but could be crushed into a powder and snorted. Effects of ecstasy usually begin within 30 to 60 minutes of taking the drug, and typically last for 3 to 6 hours after consumption. Effects of the drug depends on a person's weight, health, and how often they take it. MDMA was created in 1914 by Merck. It was thought it could be used as appetite suppressant. In the 1970s, it was given to psychotherapy patients because doctors thought it could help their moods and other aspects of their life. But however, in the 1980s, it was banned in the U.S. due to studies that showed it caused brain damage. Unfortunately, in the late 1990s and early 2000s, it became popular among teenagers and young adults. Recently, in the past 15 years, teenagers and young adults have begun to take ecstasy at parties or clubs to increase their energy to dance and party longer. But taking ecstasy combined with being in hot, crowded places typically leads to dehydration. Dehydration can lead to an increased body temperature, which could lead to muscle breakdown, kidney, liver, or cardiovascular failure, which can ultimately lead to death. A person may think that drinking a lot of water will help them not get dehydrated, but drinking too much water on ecstasy is a bad combination. It could cause brain swelling, and a person could go into a coma and possibly die. Ecstasy affects 3 neurotransmitters in the brain, including serotonin, dopamine, and norepinephrine. Taking ecstasy releases large amounts of serotonin from the brain. It takes a while to rebuild these levels back to normal. There are many short-term effects of taking ecstasy. The most prominent effect is that it produces an increased pleasurable feeling. It enhances a person's self-confidence and energy. It also causes a feeling of closeness to other people. People on ecstasy are more sociable and have an easier time getting to know other people because their anxiety levels decrease. A person's heart rate and blood pressure also tend to increase. Some other minor short-term effects include involuntary teeth clenching, fixation on lights and sounds, nausea, blurred vision, and sweating. There are many after effects of taking ecstasy. Feeling fatigue is one of the most common effects people report due to an increased energy your body had for several hours. Many people also report feelings of anxiety and depression. This is the result of the brain's inability to establish normal levels of serotonin in the brain. Other effects that occur because a person's serotonin levels are off include lack of concentration and motivation, loss of appetite, irritability, and impaired attention. A person may also have soreness in their jaw as a result of the involuntary teeth clenching while they were on the ecstasy. Insomnia is also another after effect of taking ecstasy. The major long-term effect of taking ecstasy is the damage it does to the brain. Ecstasy damages brain cells that produce serotonin. Serotonin controls mood, appetite, pain, learning, and memory. So when cells that produce serotonin are damaged or destroyed, people face problems in one or all of those areas. Most people experience mood swings, lack of appetite, problems in learning new things, and inability to remember new things due to the serotonin levels being so low in the brain. Ecstasy is a very highly addictive drug. It has become more addictive nowadays because of the combination of other drugs that are mixed in with it. People tend to usually go through withdrawal within 12 hours of consuming it. Some of the symptoms people report in the beginning of withdrawal include cravings, insomnia, difficulty concentrating, and restlessness. Some other more severe symptoms include anxiety, depression, panic attacks, and delusions. The best way for a person to overcome their addiction is to enter rehab. Following rehab, it is recommended that a person attend individual and group therapy to help them stay clean. Although ecstasy is a very addictive and dangerous drug, there are many studies testing the medical use of it. There was one study conducted to test the effects of giving it to a person with PTSD 3 times. So far, they have found that these people have had great improvements in life. Ecstasy is also being tested with patients with terminally ill cancer. It is believed that ecstasy helps reduce pain and could make their last weeks or months more bearable and tolerable. But there is not much information yet due to the bad reputation that ecstasy has.